There is a new warning coming from the FDA about breast implants and a rare and deadly form of cancer. Federal health officials say more than 450 women have been diagnosed. 9 have died. Board-certified plastic surgeon Dr. Anthony YOUN joins me now via Skype. Good to see you, doctor.
Thank you for having me on.
So this affects cells in the immune system that can be found, is this true, around the implant? It is still rare, but this is key information. So women and also health officials are educated about this and know what to look for.
Yeah, so it's called ALCL, or Anaplastic Large Cell Lymphoma. And just like you said, this is a cancer that develops in the scar tissue surrounding the actual breast implant. It's rare, about 457 confirmed cases in the U.S. So far, and they do appear to be related to a textured surface on those breast implants.
And is there a real concern when studies come out like this, although it is rare? Do you find that women do come to you and are highly concerned? Because if you hear the word deadly and you think about breast implants, is it just an infection, or is it just particular cells that may masticize?
No. Yeah, so what we think is that you have certain implants have a textured, almost like a sandpapery surface. And right now the hypothesis is that bacteria on that surface can interact with the tissues, and long-term that scar tissue can eventually turn into a cancer. So the main things to keep in mind with this is that, number one, it is definitely rare. It does typically have some type of symptom, whether it's a mass or an increasing in size due to fluid around it. And once again, it's typically due to use of textured or related to use of textured breast implants, not smooth implants. So there's two of these very different types of surfaces.
And is there a time that you suggest that women go back to their doctor once they do get the implants to double check and make sure this hasn't happened?
Well, the FDA does recommend an MRI to be performed 3 years after implantation, and then every other year thereafter for silicone implants. If you have breast implants, you notice any type of a change, you should see your plastic surgeon. This isn't something I would, anybody with breast implants should be losing sleep over, but especially if you have a textured breast implant, something that you want to get checked out with any changes. And if you're going to undergo a new breast augmentation, I myself stopped using textured breast implants for this specific reason over the last couple of years.
And all doctors, I would assume, are notified of this. Is it sent through like an email form, a letter form, a notification?
Well, the doctors need to diagnose this, and that's why these letters are going out, is so that family practice doctors, plastic surgeons, we've known about this for a couple of years, but as you've seen, the numbers are increasing. And it was important for the FDA to do this because other doctors definitely need to know what to look for.
So a general practitioner may get this letter and then focus on that actually being a possibility of happening.
Exactly, and it usually takes a couple years at least for this to happen. This isn't something that happens 6 months, later. This is usually several years later.
But to be aware of it. I see your book behind you. Bought it myself, Age Fix. Thank you, Doctor.
Thank you so much.
Thanks so much.